muscles or between fascia and other muscles. Those are areas that tend to get restricted. So the pin and stretch is kind of a cross-handed technique. It's a generalized technique that you basically pin down the structures and then slowly begin to separate your hands. And let me back up a second. The way that you look at the tissues to see if you need to do myofascial techniques is you look at it moving in all directions. The tissues should move in all directions. Different areas of the body have different tissue flexibility. Okay? It allows for motion. So some areas like the lateral part of the knee are not going to move like this, but they should move in all directions for the superficial tissues. Okay, so if I am, and you'll see this sometimes with chronic low back, you'll actually go to do this and the skin just won't move. It literally won't move. So then this superficial pin and stretch technique could be helpful. So basically you go to the area that you feel like, okay, this isn't moving real well, and then you pin down, okay, and then you start to separate. He's pretty pliable. So you see how much I can move? So that's the end point. Okay. And so if, let's say that is a restriction, then I would just hold it. I don't press into it, but I respect it. That's respecting the barrier. And I just hold it, and over time, it should release.
Can this be done without the effleurage?
Yeah, this is something you could just do without that.
So you don't even need lotion?
You need to stick the skin for this. Sometimes you actually have to use like beeswax type stuff to get tacky to actually pin the skin down. Well, I'm not even timing. I'll just hold it till it releases.
And you can feel it. It's not obvious.
You will. It will actually go, and you'll see your hands move, and it will actually feel like it releases. Now he's probably not going to release because this is. I don't want to stretch him out anymore because this is normal. But basically, that's pin and stretch, and you just hold it. Go to that end point and just hold it. Don't put additional pressure in there because that actually will start making everything fight you. You just, when you feel the restriction, that's where you stop. You just hold pressure.
Would this be good for a knot? If they had a knot in a muscle?
If it was restricting the mobility of the tissues,
Okay.
then you can use this.
Okay.
But the pin and stretch is more superficial, so it would have to be a real superficial muscle.
Is there any case where acute inflammation is in a contradiction?
Contraindication?
Contraindication.
For massage, if someone's in a real acute state, I would not be digging into them, honestly. They're not going to like it. And it's a lot different pain than what you get with cross friction to a chronic condition.
And when we're trying to figure out what's acute or not, if they just woke up that morning with the pain, like a flare-up, is that still acute?
No, that's really kind of a subacute. The only time it's acute is if it has cardinal features of acute. So just because it started this morning doesn't mean it's still acute. Right? It just means it's a flare-up of something that's probably already been there and was in some kind of chronic state, and they irritated it. So it's really more subacute. But if it's red, hot, inflamed, then it's acute. Okay. So that's a large technique. Okay. Some smaller techniques look very similar to rimming. Let's say he's got some issues in his paraspinals, and so I find an area that I feel like I can't move through. Then I kind of go to that area. How do I know? Again, I'm moving, and I can go down, I can go this way, but I can't go that way. Okay? Watch out for that door. Very fresh. Very fresh.
It's not bad, actually.
So if you maintain the pressure, all of a sudden you'll feel your fingers begin to kind of move through. It's almost like it will actually feel like it's melting away, and you can move. So I'm kind of, every time he takes a breath, I'm moving a little bit. So that would be a deeper myofascial technique. Again, the difference, I respect the barrier. I don't slide over it like massage, I just keep going. For this, I stop at the barrier and wait till it releases. Okay. So really, there are a bunch of techniques that you can use. As long as it's respecting the barrier, then it's some kind of myofascial technique. Now there are particular areas where this is more successful. The low back happens to be one of those areas. You can get very deep adhesions, trigger points, decreased mobility in the fascia in the back, especially if someone has chronic scoliosis. You know, so you can use all kinds of techniques, respecting the barrier, trying to lengthen. Another technique that's more of a stretching technique, I could have him on his side. Let's say he has a scoliosis. So I have you go on your side this way. I'm going to take this pillow out, and let's say I'm trying to lengthen this side. He's shortened or concave on that side. I could put a pillow under here to start the process of lengthening it, and then you can put your hands like this and separate it, but I actually use my forearms. And then once it kind of releases, you can kind of shift the position so you can see where is he restricted. You kind of find that place and then push into and kind of go into the barrier. You can also put a pillow under here and do ultrasound first, right? And then do this technique. But people with a lot of low back pain on one side, it works well. Especially if you use a pillow and then you do the ultrasound and prepare the tissues and then you lengthen them and then you give them a home stretch. You see how they start to build now. Okay. You can also do, for neck patients, a suboccipital release, which is a nice technique. So it's like a manual traction technique. So I'm actually going to move you up. So I can get him in this position, and I can do some light effleurage in here to kind of prepare these tissues a little bit. I can also feel, I can palpate, oh, he's got some tightness right there, and I can kind of assess what I'm going to be doing. And then the other side. And then do like just lean back. Again, respect the barrier.
This will release as well.
It should be. You want to make sure you're using good mechanics. So I'm leaning back so that I'm pulling with my body weight as opposed to, okay. If your hands slip, and they might, then you just reposition, keeping maintaining the pressure. until you feel a release. Okay. This isn't the best setup. Tired. And usually what I'm trying to do is, as I feel like it's giving, I'll reposition my hands, and I'm actually trying to. Sorry, I don't want to rip your hair.
Right? So nice.
Tuck his chin in to get more lengthening. Right, so we try and hold him in this position, like a string is pulling him from the top. Now, you can also add this with some manual stretching, in which case you kind of depress the shoulder, and you can do soft tissue work first, and then sort of other side. Can you see how much I'm actually distracting the spine? Distracting? Watch when I let go. I mean, it moves a good quarter inch. So that's like an occipital release. For people that have headaches, it's a nice technique to release. You can also, in that position, if you rest their head back on the pillow, you can do little circular friction type movements to the attachment of the cervical paraspinal musculature. That's actually, those areas can create headaches. So you can do the insertion areas. You can even do kind of sternocleidomastoid along the transverse processes where you see the knees, not the same knees, where the levator scapula comes in. You can then stretch that. So all those muscles can create tension headaches. So you can kind of, and this is where your anatomy comes back in. Where does that insert? We're going to work, does that cause you pain? You can also do trigger point work at that point by pressing it and creating some pressure if you find something. So it's a nice kind of position to kind of get in, mix up massage with myofascial release and stretching all at the same time. Okay. So why don't you try that on each other when you're ready.